Hey guys, did you know that if you add acetaminophen to oxycodone, you get Percocet? Yes. So this non-opioid plus the opioid that gives us the perfect pain relief for patients experiencing mild to severe pain. So what are some common side effects that patients can experience with this medication? Drowsiness, shallow breathing, constipation, and they can even experience nausea and vomiting. So let's talk about our nursing interventions. So my trick is you're going to take your side effects and you're going to build your nursing intervention. So number one, safety. So we know that this medication can cause drowsiness. So we want to make sure that we're giving a patient a call light to call us. We want to make sure that the bed is in the lowest lock position. Also, we want to make sure that we are assessing our patient's vital signs and monitoring the level of consciousness of a patient. So let's say that a patient is drowsy before the medication. Why we will want to give them a medication that can make them even more drowsier. The next one is we want to encourage fluids and high fiber diet because this medication can cause constipation. So instead of giving them a stool softener, we can tell them to increase their fluids and increase their fiber in their diet. And the next one is going to be assess for signs of hepatic toxicity. So this part is so big. So remember, with Percocets, we have acetaminophen. So we want to make sure that we are tracking how much acetaminophen that patient is taking on the daily. So it's important to make sure that you look through the patient's MAR to make sure that they're not receiving any other sources of acetaminophen. So some signs of hepatic toxicity, we can see jaundice, we can see nausea and vomiting, we can see dark urine. So you want to look for those things like that. And most importantly, you want to educate your patient on addiction and abuse and how just to safely use the medication. So you do want to let your patients know if you take this medication as prescribed that your chances for addiction should be low and that you can't be sharing this medication with your families and stuff like that. And then also to follow what their rules their provider gives them, the pharmacy gives them for how to discard the medication. So this was the med of the week.